Dr. Murthy, in your advisory, you note the rapid shift toward telehealth at the start of the pandemic, as well as the potential for telemedicine to serve a lasting role in improving healthcare quality for our young people. Given your medical background and your ongoing engagement with healthcare providers, what do you see as some of the best practices for clinicians as they work to integrate telehealth into their practices for long term, and what factors should they consider as they tailor these models and services to younger patients?
Well, Senator, thank you for that question. I am a big believer in the power of technology to improve the quality and delivery of healthcare if it is used appropriately. I think currently telehealth has tremendous promise to expand access to mental health care. We still have challenges to address, including expanding broadband access. We still need to ensure that not only in the public payer system, but in the private payer system, that there's adequate reimbursement for virtual care. And we also have to ensure that privacy is protected at all times on these platforms. I think as individual clinicians look to utilize virtual platforms in telemedicine, it's important not only for them to recognize and to honor those privacy concerns, but also to recognize that there are times where we do need to see people in person. The advent of telemedicine is not entirely a substitute for in-person care, but it is a good supplement, especially for people who have traditionally had difficulty accessing care. But finally, it requires a conversation with patients themselves. Not everyone will be comfortable utilizing telemedicine. Some will be more comfortable than others. Young people tend to be much more comfortable with technology. And this is the kind of tool that I believe, if appropriately introduced and utilized, can increase access for young people to mental health care.
Well, thank you. And moving to the issue of providers, our nation's healthcare workforce has provided unparalleled resilience and expertise and dynamism as they've dealt with the COVID-19 crisis. Unfortunately, while the pandemic response efforts of these past 2 years have highlighted these strengths, the COVID-19 problem has also exacerbated the stress, fatigue, and strain facing far too many of our frontline providers. A recent study found that 1 in every 5 physicians would likely leave their current practice within 2 years, and that nearly 1/3 of healthcare professionals planned to reduce their hours in the next 12 months. Dr. Murthy, in the past you've discussed the pressing challenges posed by physician burnout, which has serious implications, not just for healthcare workers, but for patients, particularly in communities plagued by shortages of providers. Expanded access to telehealth and other virtual health technologies could help to bridge these gaps. But other interventions, however well-intentioned, seem likely to increase bureaucratic strain and divert time and attention from patient care. My question to you is, what role do you see technology, from telehealth to AI and other cutting-edge innovations, as playing in reducing provider burnout moving forward? And how can we promote these tools without creating needless new burdens and stressors for our healthcare professionals?
Senator, I appreciate you highlighting the issue of clinician burnout. I'm deeply concerned about it. I think it's gotten worse, not better. And I do think technology can play a positive role, but it can also be harmful if not utilized properly. I think if technology is used to provide greater access to telemedicine, which gives flexibilities to both patients and clinicians, that can be a net benefit. If technology is designed around the needs of patients and healthcare providers, that can also be beneficial. If you give you a counterexample, you look at electronic health records right now, and many of them are designed for billing purposes, much more so than for patient care. And that creates strain and burden for clinicians at a time when that technology should be used to enable easier care for their patients.
Well, thank you very much. I appreciate this, and as the chairman said, we look forward to continuing to pursue these issues with you and the many that we haven't had time to talk about in our questioning. Thank you very much.